Hi everyone, my name is Howard Spencer from Spencer's Whole Food Plant-Based Eats and Treats. I saw a recent recording from the Morning Brew, an interview with JW and the Minister of Health and the head of the NCD unit, Dr. Maria Clapperton. And I found the content to be quite very interesting. So I was able to derive a whole set of topics out of that interview, but there's one which I want to focus on in this video. So without further ado, let's go to the interview.
Let's step now into, no pun intended, the STEPS survey 2024. Dr. Maria Clapperton, probably you could give us some details and then the minister will continue to elaborate. What exactly, for those hearing about this for the very first time, is the STEPS survey?
Well, STEPS is a shortened term, but it's actually the stepwise approach to NCD risk factor surveillance, and it is a national survey. It was last conducted in 2012, and we are doing the survey another time in 2024, and it gives us data on lifestyle practices. It's household based, so we would have field workers going to homes. They would be properly identified with their VES and Ministry of Health ID, and they would be spending time with selected participants. Participants would be randomly selected, and they'd spend about 30 minutes with the participant asking a series of questions, and then some measurements would be taken so that we're better able to perform some calculations and ascertain health status. So it gives us information on NCD risk factors, the levels that are within the population, and gives us an opportunity to trend and make comparisons based on the last survey conducted in 2012 and any projections to guide policy and management decisions moving forward.
So the last survey was 2012, that's what, 12 years ago. And you know, the whole NCD discussion was a major talking point, especially during the heights of COVID. We'll get to that in a few because I know there are some COVID concerns. But I would imagine all this is part of a bigger plan to mitigate and to really reduce some of these factors. I mean, you have gone on record. I mean, I guess many would have been up in arms with some of the statements you made concerning what we eat, what we put in our bodies. You didn't hold back at all. You didn't put no water in your mouth in that regard because you've seen firsthand the impact of the NCDs.
Yeah. So coming out of the 2012 STEP survey, let me just share one piece of data with you that deals with overweight and obesity. So we determine if somebody is overweight or obese by their body mass index, BMI. People might know that measurement. I think normal BMI is about 25.
Well, it's 18 to 25.
18 to 25. The reported average BMI for males was 25.6. So the average is on the upper limit, and 27.4 for females. So females have gone beyond the average. Overall, 55.7% of the population aged 15 to 64 was overweight or obese, and 25.7% of the population of participants were obese.
Okay, now as you see, that was the beginning of the interview with regards to the STEP survey and what the STEP survey is really. It is really a survey of the population of Trinidad and Tobago. It is a survey which really ascertains the levels of disease, chronic disease that is in the population, and also ascertains regards to the risk factors for these entities. As you saw in the interview earlier on, the last STEP survey was done in 2012, and I will go to that right now. So as you can see, this here is the STEPS report, which was done back in 2012, and the data that the minister was referring to regards to obesity, it is this data right here. I was just trying to see if I could zoom in a little bit. So as he said, 27.4 for women, 25.6 for men, 55.7 of the population was overweight or obese. The proportion of overweight or obese women was 59%, and the percentage of overweight or obese males was 52.3%. Now, this was data which was gotten back in 2012, and we're in 2024 now. And for me personally, I don't think there is much hope with regards to these NCD statistics getting better, because between 2012 and between 2024, there hasn't been a great drive with regards to changing the way the population eats. Now, there are people who will argue with that and say, well, yes, there has been things which has been done in order to get the population to become healthier. We have the Titi Moves campaign, which encourages people to eat healthier, to eat more fruits and vegetables, drink more water, and to do exercise every day. To me, that is not going to do anything with regards to improving the health of the population. You might be forgiven for thinking that way, because guess what? That is the kind of rhetoric that politicians, legislators, and people in the medical profession, that is the kind of rhetoric which has been perpetuated in the population, so much so that the general population in Trinidad Tobago, the common man on the street, will believe that the health of the population is the responsibility of each and every single person. And to me, to be frank, that is a steaming pile of rubbish. But just to let you know that, just to show you what is the kind of messaging that politicians, legislators, and medical professionals, they perpetuate this kind of logic. Let me show you some clips and some quotes from said medical professionals.
Because we live in an environment that encourages you to eat all these dangerous foods, consume all these dangerous drinks, don't move, and spend time on phones.
Now, that statement which the minister said, that is one statement which I wholeheartedly agree with. It is the environment which is causing us, the people in Trinidad and Tobago, to be unhealthy the way we are. It is because of our environment. That's why I don't believe that it's the fault of an individual for the individual become unhealthy. If what we have available in our food environment, for one, is foods which are high in sugar, salt, and fat, that's not the fault of the individual, because at the end of any day, the individual not producing these foods and then putting them in the house. Now people might say, well, yeah, but it's your choice to buy them and put them in the house. But at the end of the day, if that is what is available, and then also that is what is available because of your financial situation, well, then you really, it will be disingenuous to blame the individual for that. But then there was another interesting quote that the minister said with regards to where the fault lies.
Doctor at the Port of Spain diabetes clinic. This is a real life story. I'm not going to call the patient's name. Elderly gentleman, maybe around 50s. They did his blood work for him. All his markers, cholesterol, sugar, were bad. And so the doctor is giving this man in the public healthcare system one-to-one counseling and ask him, so what did you have for breakfast this morning? Chicken and chips. And he said, Doc, you know what I'm going to have for lunch? Chicken and chips. He does that every day. But yet he expects his numbers to be good. This is what we are faced with on the ground. And this is a man, Jason, getting one-to-one counseling.
Yeah.
And he refuses to change his eating habits.
Well, there are certain external factors, and it's not making excuses at all, because we are all responsible for the choices we make. But sometimes the economic circumstance would lead someone in that direction because it might be the cheapest meal. Children are on these devices because there are some parents, rather the child is in the house, that they could see the child as opposed to the child out in the road because of the crime scenario. The child will be snatched. So we find ourselves in such a different time compared to when we were growing up back in that particular time of, I would say, innocence. It's really a different Trinidad in 2024. What do you say to those who share that particular concern and are a bit nervous?
All right. So drinking water is free. What is the excuse for not drinking water? Explain it to me.
No excuse.
Walking around your house and your yard is free. Doing jumping jacks inside your house is free. What is the excuse? Go to Rosary Boys. Go outside rituals on Rosary Boys every afternoon. And tell me where those children get $40 from to buy a latte.
A latte? Primary school children buying latte?
Yes. Go outside rituals and see how much money is spent by rituals, by primary school children. Where are they getting the money from? Jason, we will continue to make excuses for our ill health.
Is that a lot of what is happening with the health of the nation is in our hands. But we don't see it that way. We wait until we get ill. We don't take preventative measures. Our diets are an issue, and our sedentary lifestyles are an issue.
And then there's this video which really tops it off.
Almost about 60% of the population, they're obese, and they are going to suffer with non-communicable diseases as you get older because of the disease of obesity. So when you pull the victim syndrome about fat shaming and fat acceptance, is not so. As a former Minister of Health, I am extremely concerned about the diabetic type 2 diseases and also high cholesterol in our young people because of obesity and overweight. So when you come on and you start to speak about fat shaming in society, just shut up.
Yeah. But then also it gets even better or worse, whichever way you look at it. There was an article there in the Express, a columnist by the name of Dr. Joan Paul, who is an emergency medicine lecturer at the University of the West Indies. And she has a column in the Express every Monday. And in one of her columns, she was talking about the drawbacks of using these anti-diabetic drugs which have the side effect of weight loss, and they have gotten popular all over the world because of the side effect. She was talking about the side effects of using these drugs. But there were many quotes, but there was this one particular quote which really caught my eye. And I quote, "But if you are serious about trying to have a more healthy lifestyle, you also have to stop making excuses and make at least some change, even if minor. Try to buy some lettuce every week so that you have to use it before it disintegrates. Have a fixed weekly budget for fruits, so there will always be fruits available in the household as a replacement snack. Force the change. Start with a small change, and every 3 months, add something further." So you see how pervasive this rhetoric of individual responsibility is. Up to you to ensure that you are healthy. There isn't much talk about all the other factors at play which are involved in a person's ill health. Now, there is some recognition by some medical professionals with regards to the environment. There have been a couple of local health officials who have talked about the obesogenic environment that we live in. But usually, it still all boils down to it's all up to you. Well, that got me thinking. Let's see what the Lancet has to say about that. Now, if anybody knows the Lancet is one of the most prestigious medical journals in the whole world. So that means everybody who is involved in the medical professional, both locally and abroad, know about the Lancet. And what did the Lancet have to say about obesity in its 2011 series? In this 2011 series, one of the items in the series was the global obesity pandemic, shaped by global drivers and local environments. And what was interesting to me was these two takeaways here. Now, one of the first takeaways of this 2011 series by Lancet with regards to obesity is this. Tell me if you have ever heard anything like this from our local medical professionals. Obesity is the result of people responding normally to the obesogenic environments they find themselves in. Support for individuals to counteract obesogenic environments will continue to be important, but the priority should be for policies to reverse the obesogenic nature of these environments. Please let me know if any of you out there have heard your private medical doctors, a doctor in the public healthcare sector, or any other doctor in Trinidad and Tobago has said anything like that, that obesity is a normal response to the obesogenic environment that we live in. It's normal. So in other words, if you are obese or if you're overweight, it's not your fault. You're just responding to an environment that caters towards obesity. That's what we have in Trinidad and Tobago. Dr. Rohit has mentioned that our environment has been transformed over decades to be an obesogenic environment. Our very own chief medical officer has said that our environment is an obesogenic environment. And what these authors in the Lancet have said is that obesity is just a normal response because our environment caters towards obesity. It will tend towards obesity. And it gets better. Governments have largely abdicated responsibility for addressing obesity to individuals, the private sector, and non-governmental organizations. Yet the obesity epidemic will not be reversed without government leadership, regulation, and investment in programs, monitoring, and research. And tell me, has the government of Trinidad and Tobago taken the leadership position to ensure that these environments cater less towards obesity and more towards good health? Leave your comments in the comment section below. I would love to hear what you have to say about that. But if it was to get my take on it, I would say that it's true that our environment is an obesogenic environment, and the problem is too big for one person to deal with. When one goes into the grocery stores, when you have an environment where a 2-liter bottle of black sweet drink costs less than a lot of fruits that we have in Trinidad. Now tell me if that is a matter of personal responsibility, if that is a matter of individual responsibility. And that's not my position alone. I will refer to the work of Dan Buettner. Dan Buettner is a National Geographic Fellow who is famous for his research on the blue zones. Now, the blue zones are specific regions in the world where people tend to live long. They tend to live to their 80s and 90s, in many cases even up to 100. And not just they're not just like crawling to 100. They are springing towards 100. They are largely free of the diseases that we in the Western world are most familiar with, and we in Trinidad and Tobago, especially in Trinidad and Tobago, we are a country where diabetes and hypertension is prevalent in the population, and NCDs account for 70% of all deaths in Trinidad and Tobago. In the blue zones, that's not the case. And one of the things which one of the takeaways that he took from every single blue zone, and without exception, every single blue zone, is that the reason why the people in the blue zones are healthy, it's not because of they have more willpower than anywhere else in the world. No, it is a matter of the environment encourages them to become healthier. They don't have to go to any gyms. They have no Weight Watchers. They have no apps which tracking the amount of steps they have or the amount of calories they taken. No, they live and they just live in their environment, and the living in the environment just guides them towards good health. Can you say that that is the case for Trinidad and Tobago? Without further ado, here is Dan Buettner talking about why obesity in America is prevalent and who is at fault.
I remember one single mom, she had 4 kids, she made $800 a month. You look at her food environment, there was a crappy grocery store with almost no produce. There was Burger King, Godfather's Pizza, Taco John's. The politicians were telling her it's your individual responsibility to make healthy choices for you and your family. And then you unleash her into her environment, and she's poor, she's tired, she doesn't have a lot of time, and 97 out of 100 choices that she confronts are bad. So I say that if you're unhealthy and overweight in America, it's probably not your fault.
And I'll say if you're overweight and unhealthy in Trinidad and Tobago, it's not your fault either. It's a matter where, yes, tongue-in-cheek, the whole country will have a hand to play in it. But guess what? According to the people in the Lancet, the government, they have to take by the bull by the horns, and they have to do what we put them to do in order to make us healthier, get the leadership that they're supposed to have, and actually lead us towards better health. Change the environment. Yes, here's another quote from that same Lancet article. Now, reading from this paragraph here, the effects of the population trajectories of obesity prevalence are likely to fundamentally differ between an intervention aimed at motivating behavioral changes, example, health promotion programs, social marketing, education, like TT moves, policy actions in this context, meaning enforceable actions such as laws and regulations that reverse the environmental drivers, such as reducing the cost of healthy foods and increasing the cost of unhealthy foods. Now, hear what this series said about regarding interventions to motivate behavior. The interventions to motivate behavior could be regarded as counteractions. So in other words, what they do, they try to counteract drivers of increasingly obesogenic environments by acting on some of the mediators. However, there are 2 challenges regarding this approach. Sustainability, as in whether the actions taken by people, whether they will actually follow through with it for any length of time. And then affordability, as in like how affordable can it be? I mean, there's only so much budget regards to how much advertisements you can put on TV, how much advertisements you can put in newspapers and so forth, on social media. You also have to pay people to do these things. Affordability can be an issue. However, with regards to, and one more thing I forgot to mention, these programs do not address the underlying drivers of this obesity epidemic. However, when it comes to policy-based interventions, as in interventions that aim to reverse the drivers of the obesogenic of the obesity epidemic, like, for example, you shifted agricultural policies to incorporate health outcomes. You're banning unhealthy food marketing to children, healthy public sector food service policies. But then also you could have some food industry policies. Like, for example, you have product reformulation. Like, for example, you can have products which reduce the amount of salt which you have in the food, like what was done in Finland. You can have self-regulation of marketing to children, or if self-regulation is an issue, well then what you can have is that you can have government mandated regulation of marketing to children, like what was done with regards to cigarettes. You can do that with food too, and especially foods which are high in sugar, high in salt, and high in fats, and are contributing to the NCD epidemic. Here's what the Lancet said here. If you want to get a copy of this paper, I will put a link in the description below. Policy-led solutions that apply to environments and affect the whole population, have several strengths compared with health education and promotion programs. They tend to be sustainable. They affect the whole population, including those who may be difficult to reach through all these programs. These policy-led solutions become systemic, so therefore they become part of the system, so therefore people will just naturally just be products of the system, and because the system will be much more health promoting, people will become healthier as a result, and it will help to reverse some of the environmental drivers and some of the ill effects of these environmental drivers. Policy interventions for obesity can only realistically be directed at the environment rather than the individual that is compelling them to take the healthy choices. So therefore, I hope I have shown you out there that these promotion programs that the health sector and the government, that they like to promote towards the population in order to encourage people to become healthier, that will not work, and that will never work. There has been nowhere in the world where not so much policies but programs aimed at promoting consumer behavior or a change in consumer behavior that has never worked anywhere in the world. In Finland, the reason why Finland was able to reduce the amount of salt that the population consume was because of government legislation. Government legislated that every single product which was sold in Finland, they needed to have the amount of salt labeled on the package, and if it was over a certain threshold, you needed to have a high salt warning label. That was government legislation. In the UK, there wasn't really so much a legislation, but it required government intervention. The government of the day, they liaised with the food manufacturers, and with the liaising of the food manufacturers took it upon themselves to make the products that they're producing healthier for the population. In other words, in this case, have less salt. And in both of these populations where the salt was reduced, you had a decrease in strokes and a decrease in incidence and deaths due to coronary heart disease and cerebrovascular disease. And for obesity, it will be no different. But instead, what this government has done is this.
On the heels of the health minister's public condemnation of fast food restaurants and soft drink producers comes a call from the Diabetes Association for taxes to be implemented. In a statement, the DATT says, drawing on strategies discussed at the Healthy Caribbean Coalition in July 2023, it is advocating for a comprehensive approach to removing ultra-processed products from schools and communities. Among the three recommendations are taxes on sugar-sweetened beverages and ultra-processed foods, as well as bans on targeted advertising. However, the idea has been shut down by Health Minister Terence Dialsing, who tells CNC3 News that no taxes in this regard are being considered.
I now come to basic food items. We are carefully examining the list of the most commonly used basic food items to determine which items can be made exempt from import duty without damaging local manufacturers. An example of a basic food item not made in Trinidad and Tobago but used as a staple in many households, which falls into this category, is cheddar cheese. However, to provide immediate relief, I propose instead to expand the list of basic food items that are exempted from value-added tax. This will include the zero rating of basic food items such as biscuits, cooking oil, canned vegetables, cornflakes, canned fish, canned meat, curry, juice, sausages, ham, ketchup, bottled water, and pigtail.
So you see, what the government has done, instead of taking the leadership position and ensuring that the food environment and the local environment is less obesogenic and more health promoting, instead what they do, they shut down any notion of policies that can actually help in that regard, and also at the same time make unhealthy foods more accessible to the population. Make it make sense now.